Services for Independent Living presents the impact of the direct care workforce crisis on Ohioans with disabilities.
In the disability community, the direct care workforce crisis is especially heinous. A group of Ohioans advocate for these special victims. These are their stories.
Question 1. How do you use direct care workers?
My name is Elizabeth Purcell. I am a full-time college student, currently working on my bachelor's in social work.
First question is, how do you use direct care workers?
My personal care assistant allows me to live a relatively independent life. I'm not gonna lie, it's a physically demanding job, and it takes the right kind of person to fulfill my needs. I have the ability to speak my mind and can independently drive my motorized wheelchair, but I require full physical assistance for just about all of my daily living activities. From getting out of bed in the morning, to dressing, to hygiene, to eating, my assistant is required. Some of the tasks are transportation, setting up my technology, and physical assist for school, as well as help with community integration, are paramount for my daily routine. Because I still live at home, I am fortunate my parents assumed the responsibility of household chores and meal prep.
I am a quadriplegic. I was injured when I was 20 years old. So I'm 35 years injured. They help me with everything from range of motion to washing, eating, all my activities of daily living I need help with.
Question 2. What funding source pays for your direct care workers?
Sure. My name is Kim Sellers. I am originally here from Northeast Ohio, from the Akron area. I was diagnosed with multiple sclerosis back in 1992. And even though I knew I had MS, it didn't really bother me a lot. So I didn't really put a lot of effort into it. I just had no idea what I was dealing with in 92.
What funding sources pays for your direct care workers?
Right now, it's the PCA program. I, of course, get lots of help from them with my personal care. And then I am a waiver patient. So I do get assistance through waiver as well.
Are you on My Care Ohio?
So I always get I do have My Care Ohio through United Healthcare, but I'm always a little unsure on how that works. So if it's waiver, if it's My Care Ohio, but yes, I do.
Yeah, it's very complicated.
My name is Scott Fedor. I am a resident of Westlake, Ohio, and I live with a spinal cord injury that I suffered 13 years ago, which has caused me to rely on home health care. I'm part of the Medicaid waiver program, so I get a certain number of hours a day of nursing as well as STNA or PCA help. So of which I pay my monthly Medicaid or patient liability for. So that's one source that basically helps with kind of the heavy lifting, if you will, getting me ready, doing all the skilled care. And then I'm also, that only covers certain hours a day. So there's quite a large gap, and obviously I'm fully paralyzed. I need workers 24/7. So I was fortunate enough to find the PCA program, and the PCA program provides partial reimbursement up to 35 hours a week. So another 5 hours a day on average. So that's another program I partake in, that I use. And then the other gaps that aren't covered either by Medicaid or PCA, I just have to rely on friends and family. And that can be a challenge in of itself, but those are kind of the three different avenues for which I use direct care workers.
Question 3. What difficulty are you currently having with your direct care workers?
Lots of issues where, you don't know if people are going to show up. If you're not sure if they're going to, if I see you tomorrow really means tomorrow or if it means next week. A lot of times you have difficulties keeping people for a long duration. With me, obviously, I need long-term care. So I'm really interested in finding someone that's here for the long haul and that is able to work with me. And think tardiness is always an issue. Finding people where this is what they love, this is what they do. It's very difficult to find people that are committed. And also, just the demand of the pay rate is just astronomical. You don't stand a chance, if you're not doing halfway, decent. And I'm a pretty, think I've done pretty well for myself. And, I worry every day what tomorrow's going to look like because I just can't afford to pay the numbers, that, people are demanding now.
Well, the hardest part is finding the people that want to help. They get paid so little that there's not a lot of them out there, but the ones that do want to help, there used to be a website that you go to and find these people, and now it just hasn't been kept up. It's not been maintained. So finding people right now.
Question 4. Do you have an opinion as to why you are having difficulty?
I think people in general don't understand the hardship for the individuals who are directly affected by this, both the individual in need of care, but also the families involved, as the work is not easy and the lack of compensation in terms of pay and benefits is a deterrent for people. If a person can work in a fast food restaurant for less and have less stress and responsibility for more money, then finding individuals to take on this type of work, it is going to be increasingly more difficult. Additionally, I think people do not always feel supported in terms of training, and taking on the responsibility of a person's life is a big task. And people who are conscientious may be timid to take on a task. I think creating a program to certify workers would provide a higher quality of individual and justify the higher pay and benefits that can be competitive with nursing aides.
I think it's a combination. I know ever since COVID, there's been overall, it seems like, and especially in the healthcare industry, there has been a shortage. A lot of people left and didn't come back. Um, but also with the overall shortage, I can't compete with the pay rates. I'm on Social Security and I get I make a little bit through my job, but that barely covers my my patient liability and my regular living expenses. So I don't have a lot of disposable income to be able to offer these people the rates that they want. And right now, I mean, the most I can pay people is around $15 an hour. And you can go work at Wendy's for $20 or Whole Foods or these Targets for $25. And while and then when you get to the STNAs, that job involves a little bit more a little bit more duties as far as helping me with showering and things like that. And Medicaid at the waiver program only pays STNAs about $14 an hour. And if you had a choice for $14 to come here and work with me or just go, serve coffee at Starbucks for $20 an hour, it's tough to compete with that. So I think there's just an overall shortage of people, at least that I'm aware of. And a very close second is just the competitive wage situation. There's just, it's just very, very difficult to, to stay competitive with these other opportunities. And the thing is, you'd think it'd be cheaper to have at-home health workers for the state than paying for someone in a nursing home. But if I can just go on my little soapbox here for a second, it just doesn't seem that way. It seems like sometimes the system is purposely trying to force me out of the community and back into a nursing home. And from what I hear from some of my aides who also work at nursing homes, it's a rough situation there as well too. So I recognize there's the macro economy issues with the overall workforce supply, it seems like, but then also just the pricing and the ability to be competitive from a wage standpoint.
Question 5. What happens if you do not have direct care workers?
What happens when you don't have any direct care
If
workers?
I
Your mom and dad are sick. What do you do?
if I didn't have, as I stated earlier, when the pandemic hit, during my direct care worker resigned. Therefore, my mom had to step in. She left her career of 23 years. I am fortunate she was able to step in. Otherwise, I would have had to drop out of school, resign from my part-time job. I can't even get out of bed by myself. I have no ability to make a phone call without assistance, to get in my chair to set up my phone. I can't eat without assistance. Without an aid, I would become a drain on society. With the help of a good assistant, I would become a contributing member of society rather than a drain on society. I have spent the better part of the last few years looking for a replacement assistant, but as of yet, I have not found anyone who is willing to take on this type of work. My life rests in the balance of my parents being healthy and being able to take care of me. But I know this will not last long, as I'm young, ambitious, and have plans for my future. To fulfill these plans, I will have the skills and the abilities of a good assistant. They are few and far between and unfortunately are becoming a very rare commodity.
Hospital from March 15th until June. Over 2.5 months, about 3 months in the hospital because of the wounds that I have that got infected. And I mean, if I hadn't gotten to the hospital that day, my blood pressure had dropped extremely low. I mean, I would be dead without help. There's no way around it. I'd be dead. I can't do anything for myself. I need that help. And I will not go to a nursing home. I've been to 3 nursing homes. They're absolutely horrible. I will not go to another.
It is our hope that these stories bring light to a crisis that needs to be addressed across state departments, political parties, and agencies.
Regardless of these disheartening stories, there are many awesome direct care workers, and we thank them for their dedication through this crisis.
This video is in loving memory of Sherry Carlson, who passed away suddenly in April of 2023. She was Lisa's dedicated PCA and fellow advocate for 24 years. Change never happens at the pace we think it should. It happens over years of people joining together, strategizing, sharing, and pulling all the levers they possibly can. Gradually, excruciatingly slowly, things start to happen, and then suddenly, seemingly out of the blue, something will tip. Judith Heumann, disability advocate.